And turning to the latest on the coronavirus pandemic. With more COVID-19 patients filling up hospital beds in Central Texas, we need more nurses. KVUE's Connor Board spoke with the leaders of two healthcare staffing companies who are giving us an inside look at what they are seeing right now.
COVID cases and hospitalizations surging in Texas, and hospitals are in need of nurses.
Texas is a hotbed. The demand is real.
John Maskey is the CEO of Triage Staffing, which connects travel nurses to hospitals across the country. He says in the past month, Texas has posted more travel nurse jobs than anywhere else.
We saw 3,200 new jobs come up in Texas just related to COVID demand. 3,200 jobs. And that just was last month. In August, 1,800 jobs have already come up. And we're only, 6 days into the month.
We also spoke with the CEO of another healthcare staffing company called Blue Pipes, who says he has seen the number of job postings for travel nurses in Texas double since January of this year. And Austin has seen an even bigger increase than the statewide average.
So we have about a 150% increase in the number of jobs posted on our platform from January to now in Austin.
Other states are also facing nursing shortages, so hospitals are having to pay more to get nurses to work for them. Kyle Schmidt says right now in Texas, the highest paying travel nurse jobs he has seen are around $120 an hour. But some places are still just offering the more average price of $35 to $40 an hour.
I would say that a plurality of the jobs are between, say, $55 and $80 per hour, which is quite lucrative for registered nurses. Although I will say the job that they're undertaking is quite a difficult task currently.
We've seen an increase in pay upwards of 30% to 50% of where it was just 3 months ago. As COVID demand has increased.
We reached out to Ascension Seton, Baylor Scott and White, and St. David's Healthcare to see if they are paying more to get nurses hired on. They said in a joint statement, given the recent surge in hospitalizations affecting facilities in Central Texas and throughout the state and the statewide nursing shortage, all three healthcare systems are sourcing staff using multiple resources, increasing shifts, paying critical staffing bonuses, and redeploying non-nursing staff to assist with non-clinical tasks. John Maskey with Triage Staffing says they're expecting this need for nurses to keep growing through the end of the year.
We just continue to forecast a bigger demand. The number of jobs that we have as a company has increased by about 20% just in the last month. And we envision that could go up another 15 to 20% in the next 30 days.
Reporting in Austin, Connor Board, KVUE News.
A spokesperson for those three major hospital systems in Central Texas also told us most of their COVID hospitalizations are unvaccinated people. They say the best way you can help our healthcare workers is by getting the shot. And you can keep track of the latest COVID-19 updates in Central Texas. Text the word COVID to 512-459-9442. You can see the number and the prompt on your screen. We'll send you the latest details. You have to text. Calling will not work.